Good morning, everyone. I am Dr. Swarupa Mitra from Rajiv Gandhi Cancer Institute once again to talk to you about some relevant topic like every week. So today we are not going to talk about cancer. We are going to talk about a topic which is very relevant about coronavirus. So there are a lot of news recently about coronavirus and the infections it causes and the outcome. So let us try to understand what coronavirus is and what are the infections caused by coronavirus. So coronavirus, as the name suggests, it's just a group of virus. And this virus, they infect mammals, animals and birds. Now, why has it become so important or so much in news now? Coronavirus actually was discovered long back in 1960s, and there are a few infections reported, which were some of them were fatal. But recently, it's as early as recent as 31st December 2019 that WHO was reported by a kind of infection, a pneumonia-like infection, which spread in a city in China, and this pneumonia was very different, found to be very different from other pneumonia, and people were dying from it. So this was reported on 31st December 2019. And soon after, on 7th of January, this was diagnosed or identified as a very new kind of virus, and it is a coronavirus, and very temporarily it was named as 2019 N for novel coronavirus. So this is a brief history or a brief understanding from where the coronavirus originated. Now, why are we so scared about coronavirus? So let me be very clear. Coronavirus infections in human being is very subtle. It is curable, and most of them, they are just cured with some crocin or paracetamol or with some rest. Normally it affects the upper respiratory tract. It may cause running nose, it may cause a stuffy nose, it may cause a cough, sore throat, fever. So these are generally what coronavirus causes in most of the infections. And this is generally treated on its own with some very conservative management. But what happens when it infects the lower respiratory tract? When it causes pneumonia, some of them may become fatal, and this is what has happened with the present coronavirus infection in China. Now, how do we diagnose these coronavirus infections? Actually, it is very difficult to diagnose. If we do a blood test and you can't find them in them, it manifests like any other infections. Any person who is infected with coronavirus initially will have that same running nose, stuffy nose, and some fever, malaise, that is weakness, loss of appetite, cough and sore throat. But when it causes difficulty in breathing and the lung is affected, then you need to go to a doctor. Then you may need some help and some more battery of tests, and which will be helping you to recover or give the appropriate treatment. Now, what are the tests? Like I said, there are not many tests for coronavirus, and unlike many other viral infections, there is no vaccine. So be very informed that there is no vaccine as yet for coronavirus, although in China scientists are working on them, and maybe in April, May or late 2020 some antivirals or vaccines, they do come up, but right now there are no vaccines for coronavirus. So all we need to do is get prevented from getting a coronavirus infection. To get prevented, we must understand that how does a coronavirus infection spread from one person to another? It spreads by droplet infection, that is, by the sneeze of the infected person, by the cough of the infected person, and by touching those infected droplets from the infected person. So, when you touch an infected person and then touch your face, nose, mouth, this is how you may get infected. So this is very simple to understand, that when an infected person is there, that you should prevent yourself from touching that person, and even if you have touched that person, you should not contract it yourself. So how to prevent ourselves? What do? We do not know who is suffering from coronavirus infection, but without knowing, so we have to prevent ourselves. If we touch an infected person or a person who is suffering from cough, cold, sneezing, then be very informed, or be very careful that if you touch that person, or not only the person, the things or the substances which have been touched by that person, then you should not bring that finger or the hand to your face and nose, or touch yourselves. Then you can contract a coronavirus infection. So what do? Clean your hands. Very simple, hand washing. Clean your hands whenever you touch an infected person or a person suffering from these symptoms. Clean them with some water, soap, and some alcohol disinfectants. Keep yourself healthy, eat healthy food, drink a lot of water, because this water washes your body. And just maintain clean habits, have good sleep, about 6 to 7 hours sleep, and healthy food. So that is all you can do. So coronavirus, it is till now, there is no case which has been identified in India. There are a few cases in China, and they are doing their best to get them all controlled. So here in India, being a neighboring country, we do not need to be very scared about coronavirus, but yes, we need to be informed ourselves that we can prevent ourselves just by maintaining some good habits, cleaning our hands, that's all. Thank you very much.